Hey everyone, Dr. Geyer here. I do a lot of food allergy and food sensitivity testing in my practice, and I also see a lot of chronic complex care patients who have things like mast cell disorders and mast cell activation syndrome and things like that. And there's a lot of confusion. These are still all kind of lumped together, and people are trying to tease them apart. So I want to do a simple overview of these for you and explain some of the differences, and hopefully that will help some of you to understand the difference between maybe a food allergy and a food sensitivity. So I'm going to share my screen here and show you a couple of things if this works the way that I hope it does. Okay, that's my family in the background. All right, so these are immunoglobulins. They're a little bit blurry as I blow them up. They become more popularized in the last year, of course, because of COVID. People actually know what antibody testing is for one of the first times. It might be something good that came out of this whole thing, if we can focus on something that was good. And you can see here there's the IgM, which is an immunoglobulin or an immune cell that is released in response to an infection. So that's a lot of our antibody testing when we're testing things like COVID antibodies. We're doing things like IgMs. We do this for all types of bacteria and viruses. We test IgMs. We also have memory cells, those other immunoglobulins. We have IgGs, IgAs, IgEs, and actually we have something called IgDs, which we don't talk a lot about because it's not a lot of our immunoglobulins and it's still unclear as to what they do. IgGs are another one that we're testing with things like bacteria and viruses as a memory of a past infection. And of course, there's some nuances there. Now, IgAs, when we're talking about food sensitivities, we're talking about IgAs and IgGs most often. So that's really important. And when we're talking about allergies, when you go to an allergist, they're testing oftentimes your IgEs, or they'll test how your mast cells are responding. So that's IgEs, and so that's what we call allergies. So IgEs are allergies, IgGs and IgAs are sensitivities, and that's a very different immune response. And then IgMs are what we were talking about. Look how pretty they look. Are what we were talking about with infections, okay? Here's another really pretty picture. You can see them not quite as blurry of the different immunoglobulins. And these are antibodies, again, IgG, IgE, IgD. You can see what an IgA looks like right here. And then those IgMs, which look quite different. Now, when you go to an allergist to test your allergies, they're going to do it one of two ways. They're going to test it either on your skin or in your blood. This is skin testing, which some people are intimately familiar with. There is prick and there's patch testing as the two main types. And what they'll do is they'll put a bunch of things on your skin and they'll watch the histamine response. So it's called a wheel here, and they'll measure it. And then they have controls. So they have a positive and a negative control. And their negative control right here is usually something like saline or sterile water, something along that lines. Histamine is the positive control, obviously, because that's what they're measuring, that histaminic response. And then these are the things that they're looking at on your skin. So that's histamine. That's not an IgE. So most people don't know the difference between that. And often there's confusion as to whether or not the skin testing or the blood testing is more accurate. And the response really should be they're testing different things. So you're testing IgEs in the blood, and here you're testing a histaminic response right there on the skin. So what does that mean? Here you can see with allergies on your body, your IgE is actually going to bind to a mast cell. The allergens dock to, so an allergen is, let's say, your dog allergy or your peanut allergy. That's an allergen. Is going to dock to that IgE, and that IgE you can see here is going to dock, and then the mast cell will be activated, and then it'll release histamine. Now, mast cell activation disorders, mast cell activation syndrome, quite different and very, very confusing because there are over 1,000 bioactive substances in a mast cell, and we're talking about histamine here. So that's a totally different thing that we're not even going to talk about today. And then somebody has an allergic reaction and they itch. Now here is a blood test. And this is our blood test. This is from a patient of mine measuring their IGEs, so their immunoglobulin E, which is what an allergist would look at, except this isn't a skin prick or skin patch testing. This is obviously in the blood, and this particular person reacted to these two things, and then they put it on a scale. And sometimes these are anaphylactic allergies that we think of, like your lips swell up and your throat closes and you need an EpiPen if they're high enough, and sometimes they are not, they're lower grade. So there's also this misunderstanding that when you have IgE allergies, you can't have them if you don't have anaphylaxis, and that's not true either. This person's not gonna have an anaphylactic reaction to the maple right here. They're gonna have maybe some itchy eyes or some runny nose. They may have, any number of low-grade allergy symptoms. Okay. I like this picture so we can do a quick review of those IgGs, IgMs, IgAs, D, and E, because IgEs, remember, are anaphylactic. IgGs and IgAs are food sensitivities or sensitivities to things. When we talk about that, that's important because IgAs are happening on the mucous membrane, which you can see here. That's the nose, mouth, throat, the intestines, the vaginal mucosa. That's mucous membranes, which might cause a runny nose or an itchy throat or mucus, or in kids, we see a lot of ear infections. You might have some abdominal pain, some nausea. You might have diarrhea or GI bloat or gas pain or any number of things. And for some women, it's irritation in the vaginal mucosa because that's still a mucous membrane. That's where these IgAs are happening right here. Now, for other people, they might create an IgG. An IgG is a systemic reaction. You can see up here, the rest of the immunoglobulins are happening all over and circulating. IgGs can happen anywhere, which makes it super confusing because you didn't get that runny nose or that itchy skin like you might an IgE. Let's say if it touches your skin and you react to grass, that's that IgE response. Maybe you didn't get a runny nose from it, which could be an IgE or an IgA, but maybe you got a headache or you feel inflammation in your body or you have joint pain or any number of things. It's having a systemic immune reaction. That's an IgG right up here. And you can see there's 4 main subclasses of the IgG, which I'm not going to talk about. Okay. So this is a patient of mine as well. This is a food sensitivity, not allergy test. So you can see there's no IgEs here. There are different things that we can measure. I measure IgAs and IgGs both. So this is something over the years that testing has gotten more refined. It's gotten better, very important. I, in particular, only use one lab versus other labs that I've used in the past. So that has changed. The science has changed. It's definitely gotten better through the testing. And it is accurate, although there are nuances of it. So it's still an immune reaction. And I think it's poo-pooed a lot on when people say, oh, that's not accurate, or, oh, I had testing done before and this is different. I don't know what kind of testing you had done before. If you bring it into me, I'm happy to look at it. Sometimes it was just IgG testing and it wasn't IgA. Sometimes it was not a reputable lab. I, in particular, like to send split samples to labs and check them against each other. So this particular one has an IgA. Remember, that's a mucous membrane, nose, mouth, throat, intestines, vaginal mucosa, those mucous membranes. And then IgGs are happening everywhere, which for some people seem to be the same areas over and over. And for other people's, it can also be in the intestines. So it doesn't mean that an IgG can't give you diarrhea or an IgE or an IgA. So don't limit, look at all of them in respect to each other and your symptoms. And it's important that your doctor does the same thing. Now they are cumulative, and I often describe these to my patients as like the military. like they're all the military, they're all your protection, they're your immune responses, they're your soldiers, protecting you from everything, like I said, from infections with those IgMs to invaders that it sees at the mucous membrane that you swallowed with an IgA, or something that touched your skin perhaps with an IgE, or those IGGs that are happening everywhere. Now, again, this is a little bit different for infections. I'm just talking about sensitivities and allergies. But there's still two different types of soldiers. So I look at these as cumulative. This person reacted, had an IgA and an IgG to capers. And so that's still, that would be like, the Army and the Navy both going out. It doesn't change the fact that they're all military, so I add them all up. It's a double immune response. Okay, so now you can see the way that I'm looking at allergy and sensitivity testing. And again, I'm not touching anything like mast cell activation syndrome or anything like that today, because that's a whole other slew of conversation. But hopefully that gives you an overview of the difference between an allergy, which is your IgE, your immunoglobulin E. You understand histamine and what's happening there with a mast cell, and you understand that allergic response. The IgE that's happening in your blood and happening in your body versus touching on your skin versus an IgG or an IgA that's happening, IgA at the mucous membrane, IgG happening throughout your entire body. And then when I look at that, I'm looking at what people's symptoms are. So I'm not running these tests on everyone. I think that that's kind of a waste of money and time, even though maybe everyone would benefit from it. So talk to your doctor about it, make sure they understand the difference. And then I'm happy to answer any general questions, but can't give medical advice if you're not my patient. Wishing you well.